Now we'll talk about another segment of caring for a patient after a surgery, and this is the immediate post-operative care. So immediately after a surgery, what are the things you might actually want to do to a patient that might actually help their situation and all? So immediate post-operative care is what we are looking at. So this care actually just focus on you're trying to stabilize the patient, and this is immediately after surgery. Okay, so you have to transfer them to the Post-Anesthesia Care Unit if available. So it's also called a recovery room. So those ones, they are closely monitored, and if anesthesia is needed to control all those pains, it can also be administered. You monitor for their vital signs. Make sure that they are breathing. Make sure that the airway is open. Make sure they are breathing. Make sure blood is circulating. Make sure their body temperatures are actually 100%. Okay. The pain and nausea management is you administer all those opioids, non-steroidal anti-inflammatory drugs, and regional blocks. They also give drugs that will actually stop vomiting, okay, tendencies of vomiting and all of that. The neurological assessment, this is where you now look for you access their consciousness level. Use tools like Glasgow Coma Scale, orientation and responsiveness. So that one, you're just trying to engage the patient, ask them some 1 or 2 questions, and make sure that everything is okay. Fluid and electrolyte balance. This way you make sure that the fluid they are taking, the electrolyte, is balanced, just literal, you understand. Wound and drain care, you check for bleedings, check for swellings or any signs of infection. Then the drains and the catheters, you just have to make sure that they're actually functioning 100%. Then you position the patient in a way that their breathing will be 100%. Okay, side rails may be raised because you don't want them to roll off the bed. Okay, so early detection of complication, watch out for airway obstruction, watch out for hypotensions or hypertensions, watch out for arrhythmias, watch out for respiratory depression, watch out for bleedings or hematoma. Always document everything you are seeing or observing.